there was an announcement. Well, it was actually an exclusive to TVNZ. This government's leaking like a sieve at the moment. There was an exclusive on TVNZ. There was an exclusive on 3 News, which we'll get to later. But there was one about health. I think maybe you guys have already reported it. I think this is the official exclusive on 1 News.
It's the Sunnies.
I think this is actually this footage. I joke. I joke and I jest. There is a story we're going to look at, but me and Chewie have been a little bit critical of the Labour digital footprint, Kieran, and I would like to tip my hat to your TikTok account people at the moment. They're doing a real good job. Really, really good job. Really good job.
Well, that's good. They'll probably will see this themselves, but I'll make sure I pass it on tomorrow nonetheless.
Let's have a look at this though. Remember, we get rid of the backroom people. It's not going to impact the frontliners. Remember that.
Axing hundreds of IT roles at Health New Zealand could lead to, quote, catastrophic failures. That's according to risk assessment analysis by Te Whatu Ora's
apparently IT could possibly impact the front line maybe.
Own team that's been leaked to 1 News. The union representing health staff is warning patients could die if the cuts go ahead. Senior political reporter Benedict Collins has more.
That'll be one. Oh, that's too. I was going to say something too cold. I was going to say that'll be one less off the public health ticket then, so it would save some money, but no. That's even too harsh for me, maybe.
Annex is hovering over 653 data and digital staff who help run our health system, as Health NZ looks to slash costs. IT upgrades also on the chopping block.
It is likely that patients will...
Can I just ask, hang on, I just thought of something. IT upgrades are on pause, but Luxon was able to upgrade the equipment in his office even though the equipment that was there worked all through COVID for Jacinda. But in the health system, IT upgrades are on the got to hold on those. That's interesting, eh? Just kind of putting that out there, just putting it out there.
For injury or death. It is as serious as that.
1 News has obtained a document revealing Health NZ's own experts believe many proposed changes come with extreme risk.
Doctors and nurses need the best IT system that they can get to provide the patient care.
The detailed analysis points out a series of concerns, including a 30-year-old IT system at Auckland Hospital, which Health NZ says is at imminent risk of catastrophic failure.
Yeah,
the risk of clinical information such as referrals getting lost, which could see patients falling through the cracks and missing out on care. And that emergency responses will be compromised during major disasters with the reduced ability to coordinate. It looks like there could be
None of that feels that bad though, right? I mean, that's okay, I think. We'll just let him. This is actually a really interesting point because I think this is Magenta. I think that's the CE. Knows nothing about it and tries to undersell the leak.
Coordinate. It looks like there could be dire consequences, though, if you proceed with some of these plans that you're looking at.
It's very early input, I understand. I hadn't even seen it.
The frank assessment news to Health NZ's boss.
We want to go into this with eyes wide open, and I really do appreciate that our staff are putting their thinking caps.
I appreciate the staff has leaked this to TVNZ. That's what she's actually saying. It's beautiful.
Into this with eyes wide open, and I really do appreciate that our staff are putting their thinking caps on and assessing the potential impact of these proposals.
Yeah, do you think this is kind of a whistleblower act here, what with this document coming to 1 News?
No, not at all.
The advice also warns mass digital job losses will lead to more outages and incidents and decreasing quality of care and safety for patients. That doesn't sound good.
We have some standards and expectations of maintaining service continuity, so that's not negotiable.
The former health minister says the message is clear.
The government is being warned here that these cuts could seriously put patient safety at risk. They need to stop them.
The health minister wouldn't be interviewed, saying it was an operational matter, but added he's been reassured the health reset is being undertaken in a careful and considered manner. Benedict Collins.
We can't, I mean, you guys probably can't as well, Kieran. The idea of the CEO talk, this is a reset. This is a health reset. We're just going to reset it and continue using 30-year-old technology at our biggest hospital. But look, as I said, that's not in the show notes, but you're here. Thoughts?
What really gives me the shits is when ministers instruct departments to cut X billion out of their budgets, and when the consequences of that direction comes forward, they say that's an operational matter. Front up. Shane Retty has told the health department to find $1.4 billion worth of cuts. And this is what happens when you do this. The hospitals without enough workers and doctors and nurses is what happens when you do this. Health New Zealand actually are doing what the government has told them to do.
Yeah.
And so he shouldn't be so gutless as to put the CEO in front of them, who has no choice but to defend it. He should be the one that's fronting it. We're seeing it across the board. We're seeing it in police. We're seeing it in transport. We're seeing it in housing, across the board. Ministers are claiming, and social development is a prime example. I know that's an operational decision. Rubbish. It's your decision. So front up, because this is what happens as a result of what you've decided to do.
And the other thing, and Margie Upper said it then, basically we have an expectation of outcomes that we're going to reach. It's the same sort of thing, right? Like I remember working for a radio station where the boss there gave us announcers this conversation talking about David Letterman and the prep that David Letterman does for his show and how he gets ready, to try and encourage us. I waited for the appropriate time and everyone had left, and I just said to him, when you give me 23 writers like David Letterman's got, then I'll produce for you the same content that David Letterman does. And it's the same sort of thing. We're cutting, but you have to have exactly the same, if not better outcomes. It's some kind of parallel universe that doesn't exist. Chewie?
Yeah, I've got a couple of thoughts. This is this is a very Dunedin analogy. I apologize.
Spates? Has it got spates in it?
So you were silly and you didn't order firewood back at the start of the year, and now it's winter and you got nothing to burn. So you have a look under your house. You got all these wooden beams holding your house up. You surely don't need that one. Maybe you don't need this one. Maybe you just keep on taking it out so you got wood to burn, and eventually your house falls over. Like, this is what it feels like. Let's just kick out this beam and see how long it can carry on for. And we've said this right from day dot, right from when these health cuts especially were first rolled out. This feels like setting the scene for full privatization.
The thing is, too, with that analogy,
enough foundations.
Yeah, you hadn't had a chance to rebuild the floorboards before you started burning them again. That's the thing. We've been here before. This is exactly the playbook that happened under Key. It was just happening under someone that was a bit more charismatic and articulate. And so it's exactly the same thing. They cut the funding. They claim that the services are fine. They keep telling the public that. It's reached its severe consequences a bit earlier this time around because they're doing it in a real fragile time for us. We're coming out of the pandemic. The economy hasn't, recovered like they promised. In fact, the decisions that this government has made is prolonging the recession. 15 economists that signed that letter have demonstrated that. We can't afford to, or we're not in a position to withstand this onslaught because we didn't get a chance to rebuild properly. And so it's every warning that was on that TVNZ story tonight should be heeded, because these people know what they're talking about. Not just because they're experiencing now, but they've seen it before.